Hello. The following presentation by Khuloud Edwards describes one method of conducting comparative effectiveness studies using match case control design with retrospective data. In this presentation, we will learn the definition of comparative effectiveness, the benefits of using comparative effectiveness in the health sector, and how to match controls and cases using Excel. What is the comparative effectiveness? Comparative effectiveness can be defined as the direct comparison of existing healthcare interventions to determine which works best for which patient and which pose the greatest benefits and harms. The core question of comparative effectiveness is which treatment works best for whom and under what circumstances. To achieve the purpose of the comparative effectiveness, data are collected for evaluation purpose and electronic medical records are used to assess the impact of the intervention. Although there are limitations, these techniques have yielded surprising and important insight in clinical care. What are the practical benefits of comparative effectiveness? As a patient, you deserve the best and most objective information about treating your sickness or condition. For example, someone with high blood pressure might have more than a dozen medicines to choose from. Someone with heart disease might need to choose between having heart surgery or taking medicine to open a clogged artery. Reports on these topics and others include the pros and cons of all the options so that you and your doctor can make the best possible treatment decision for yourself or even for someone in your family. Also demonstrating that expensive medical therapies are equally or less effective than cheaper alternatives. Comparative effectiveness could certainly lower costs by eliminating the use of costly treatments. Matching criteria. Now we'll talk a little bit about the differences between cases and controls. Patients who have received the intervention are referred to as cases, when patients who did not receive the intervention are referred to as controls. For example, patients in the traditional nursing home program may be considered as a control. However, patients who were admitted to the medical foster home program, this is an alternative to nursing home care, who after months of treatments leave it for care in nursing home, may be considered as a case. The intervention here is moving from one location to another for a specific time of period. Unfortunately, transition from one intervention to another is almost always accompanied with a major crisis that affects patients' health. Analyzing matching controls to case table. So we can see based on the table 1 of procedure for matching controls to cases, we will identify the two patients are matched controls for the cases by using age and the lowest random number standard. So we can see in the table that there are two cases, case number 1 and case number 3, where the variable treated is yes. That means the patient has received intervention. There are 7 controls, 2, 4, 5, 6, 7, 8, and 9, where the variable treated is no. That means the patient has not received the intervention. Now we will calculate the standard deviation for age across all 9 patients in Excel. You open an Excel sheet, then you will calculate the standard deviation in Excel by typing equal ST, then you will select standard deviation. The abbreviation is STDEV-S. Then you will select the age column, numerical data from 1 to 9. Then you will press enter. Then you will see that the standard deviation is 889. You will repeat the same steps to calculate the age average, but this time you will type equal average, then you will press enter, and you will see that the average is 73.6. Now, for each patient that received a treatment, we'll calculate one standard deviation interval based on their age. You can see the table below. The option of the controls who can match case 1 are 2, 8, and 9 because their ages fall in the range between 56 and 74 years. And because we're looking for the possible controls using the lowest random number, so the answer for this one will be patient number 8. The second one, that the options of the controls who can match case 3 are 4, 5, 6, and 7 because the same thing, their ages fall in the range between 75 and 93 years. So the possible controls using the lowest random number, that would be patient number 4. I hope you find this presentation useful. Thank you so much.